Welcome to the next episode of Scalpel Talks with Jim. Today we have another esteemed guest, Dr. Balagughan, who is principal of Karpa Vinaya Institute of Dental Sciences with us. Welcome, Dr. Balagughan, to the show. As I introduced you, you are one of the young oral maxillofacial surgeon to lead a dental institution. How do you feel leading an institution at such a young age?
Actually, I'm learning now. I'm not leading, I'm learning actually. Learning lot of things. It's actually totally different field. So I'm just entered into that administrative post. I'm learning. Because maxillofacial surgery, it's totally about our passion and day and night that we are practicing it. But getting the college into next step or putting others into our place or leading the college is totally different administrative. You need some separate capacity and capability. I'm slowly learning that.
That is a very humble and modest reply that you are learning. Yes, learning is a continuous process, and as a young leader of the institution, I'm sure there will be many senior people who will
Yes, sir.
be
Yes.
working, and it requires a lot of administrative capacity and to lead them. And as I have seen you over the years, you have that well matured smile to get things across. And thank you so much for that very humble answer. And taking you back a few years,
Yes.
uh, what was the reason when there are so many other specialties which that you could have very well taken
Yes.
the fact that you are a meritorious student during your undergraduation? Why did you choose oral maxillofacial surgery as a specialty?
The basic thing for all maxillofacial surgeons, we are not getting a MBBS degree. That is the same thing. Even I got it, but at present I don't have any regret it. Second thing, it's a very interesting incident actually. I was about to join maxillofacial surgery in Ramachandra. Unfortunately, I got only prosto.
Okay.
So 3 months I did my prosto program. I finished my preclinical work, everything done. One fine day, suddenly I got a call from maxillofacial surgery department by exchanging a student.
Okay.
Kind of night duties and all those work pressure that can't handle by another student. So eventually we applied to vice chancellor, a chancellor. Then finally we moved into our maxillofacial surgery and he moved into prosthodontics. By that only I just got my.
That
But really I was waiting for that 1 year period. I was waiting to do oral surgery. I didn't get finally. By this progress only
I
it came there.
understand. So, as destiny would have it,
Yes.
even though you happen to join another specialty and then
Correct.
uh, you ultimately landed up with a specialty that you
You correct.
wanted to. But my question is, why did you want to be an oral maxillofacial surgeon when compared to the other specialties? Yes, like what you said, MBBS.
Yes.
Other than that,
See, the doctor prefix that we are going to put it now, sir. Really, we have to save the lives in some situation. It can be in OT or it can be in OP or anywhere in lifetime situation. Oral and maxillofacial surgery in dentistry, it has a slight edge over other specialties that you can always deal with life situations. And I want to be part of that one. That makes me to become a maxillofacial surgeon.
and now you're leading an institution, leading the department,
Yes.
heading the department. I have heard many youngsters coming and telling me
Yes.
that Balagughan sir is a good mentor. He was a good teacher and is a very good surgeon. A good surgeon, a good administrator, and a mentor. How do you play all these roles simultaneously at your
So the teachers and mentors, no, these both it came from my mentors. had different mentors in different period of time. From undergraduate time to postgraduate time, still I'm inspiring most of the mentors. They may not be knowing that, but I know.
It's a silent way of silent admiration.
Yes. And they behaved me like this. So they thought the mentor how you are supposed to be, teacher how you are supposed to be. I'm just following their footsteps. Administrative thing, I'm just entered in. I'm just learning it. So slowly, I should become at least a part of that one.
And you're a fantastic surgeon. You do various variety of cases,
Yes, sir.
starting from simple trauma
Yes, sir.
to craniofacial to orthognathic
Yes, sir.
to oncology and
Reconstruction.
reconstruction.
Yes, sir.
So how do you develop that interest with a wide gamut of all the cases?
Yes, sir. The even though my fellowship program mainly focuses on only craniofacial surgery, but I took a firm decision once completing my maxillofacial surgery, I should not open up any clinic. That is the first thing I decided. It's not like that other specialties are low or my specialty is too high. If you are going to divert your skills to other specialties, you can do endo work, you can do prosto work, you can ask any help, all those things. But you will be losing interest in the prime focus.
Specialty.
Yes, sir. So because everyone know you can't roam here and there for a long time, all those things they used to tell. But I developed good set of friends, good set of clinicians who, they can pick me cases for me. Maxillofacial. See, even some of my gurus, they used to call me for specific cases. Rest everything they will do. For more specific cases, yes, you can do better, so you come and do. It's kind of we have to focus on maxillofacial surgery, then the maxillofacial surgery spectrum that you can first
Yeah,
step into
I
it.
understand. When I was heading my institution,
Yes, sir.
one of a colleague from Department of Orthodontics
Yes, sir.
came to me and asked, "Sir, can we invite Dr. Balagughan for a workshop on virtual surgical planning?"
Yeah. Oh, got it, sir.
Hope you remember that I
Yes,
reached
sir.
out to
Yes,
you
sir. Got it, sir.
at the time, and he said, "Yes, let us call him." And the reason why I'm asking this question is because more often than not, now these days, uh, if you're more focused on trauma, you continue doing trauma
Yes, sir.
and orthognathic maybe
Yes, sir.
and minor surgeries.
Yes.
But you are doing a wide range of work from reconstruction to orthognathic
Yes.
to craniofacial. So that is what intrigues me.
The
Maybe like what you said, your mentors.
yes.
Uh, I think,
Yes, sir. The reconstruction alone, it's purely because of my Dr. Madan. Because he used to operate for resection, everything. So I am forced to do it. One or the other day, you have to, no, you pushed into reconstruction, do reconstruction. So I have to go ahead with the special training and conferences, workshops. And I have to go back to my original mentor to learn specifically. For a month, I'll be here, sir. Please teach me. So basic fundamental, they'll start for microvascular suturing, all those things. Then my plastic surgeon plays a very crucial role. From the first day of his case, we started operating together. His first private case, we started in private hospital, means 20, 22 years before, while I just finished my post-graduation. So the reconstruction part, from the day one, it is there. But to answer your question, literally I pushed into for reconstruction.
yeah, actually, I've been wanting to know this reason, but at last I got the
Yes.
answer because it is not easy.
Yes, sir.
Yes, you are pushed, but then you also had the passion to
Yes, sir.
do it, continue doing it.
Yes, sir.
So I think for the next generation of oral maxillofacial surgeons,
I don't know, sir, because this is give a little no upper hand or lower hand, because I don't know, because more maxillofacial surgeons nowadays, they are focusing into a particular topic. If they are doing TMJ, yes, call Jimson sir, TMJ sir is doing. Okay, trauma, if someone is there doing orthognathic surgery, okay, call this one or two, like done. Call Bala for anything, I don't know for what they are calling. So I don't know whether I'm missing that, whether to focus on one thing or doing entire spectrum of maxillofacial surgery. I don't know, sir, really.
No, the best thing is you're doing a whole spectrum of things
Yes, sir.
and you excel in everything. See, that is a very important
Yes, sir.
point. So it is not about doing everything and not excelling in everything. And that shows your dedication. As you rightly said, you are pushed to into it.
Yes.
But then your dedication has taken you to the next level. And you are very modest in accepting that fact. But I would rather say that your trainees are really blessed
Yes, sir.
to be trained under you. And
Surgical skills wise, yes, sir. Absolutely. They can.
And can you throw some light on where you did your undergraduation?
I did my undergraduation in Annamalai University after wasting one year, like trying for MBBS. So did the improvement in 12th marks again, still lack of 1 mark, and again do BDS in the next year. It's in Annamalai University, sir.
Yeah, I know you're talking about 1 mark. We understand the even if it's a fraction of a mark, what you can lose. Yes, from a prestigious Annamalai University.
Yes,
There
sir.
again, I'm sure you would have done under the
B. Srinivasan,
yeah,
sir.
so that would have been another inspiration for
Yes,
you
sir.
to take
From
up.
the starting onwards, that is
yeah.
the exclusive department that they can go ahead with OT and number of cases lined up with the operator and going to get operated. It's from the first day onwards, you can start inspiring these.
Exactly. So you had a great mentor there itself
Yes,
during
sir.
your undergraduation,
Yes,
and then you chose to be in another very prestigious university for your masters.
Postgraduate. Yes, sir.
Masters
Yes, sir.
and trained under
Dr. Ravindran sir,
Ravindran
Dr.
sir
Ravindran sir.
and other
Dr. Ramkumar sir and Dr. Nandakumar sir was there along
yeah.
with them. Dr. Sanjay Sundar sir was there along there.
Yeah,
Dr. Saravanan sir was there. Yes, sir.
So you were
Whole team of surgeons.
lucky to be
Yes, sir.
trained under them. And what did you do immediately after your masters? Did you join academics, or you were only into freelancing consulting?
Yes, sir. Two things I did, sir, actually. Joined because new colleges were opening on the time period. Once I finished the 2007 period, 8 to 9 colleges they opened up. So immediately got a job, that too through Mentor 2. Second thing, I didn't start up a clinic, but I have to go consultation to multiple clinics to take an impaction kit, seal with the 5-6 set of instruments. Then once the college is done, go along with two friends, all those things. That time almost going to 112 clinics or something like that, sir. that means
phenomenal hard work has
Yes,
gone
sir.
into that. I've never heard these numbers.
That time I was having these numbers, sir. And weekend means then I'll go to my native. Because native, my seniors are there. The sense they'll be waiting, they'll be pulling up all cases, cyst, periapical surgery, impaction, all those things. So 2 days I'll be roaming around in my native place near Mailadurai, Kumbhavanam, Tiruthipundi, all those things I'll be 2 years. Then 2 days after that I'll come back to college again directly.
A message for the next gen. You should learn from hardworking people like Dr. Balagughan, who has been working so hard to reach this stage, having consulted in more than 100 plus clinics when he started off his career as a budding maxillofacial surgeon. Fantastic, Bala. And hard work. Always
Actually, that
pays.
is not a big thing for me, sir. Once you have to leave, once you got the fellowship, you have to leave everything, then you have to go.
Exactly.
That is the.
That I'm coming to that question next. Because then you joined your academics.
Yes, sir. 4
You
years.
were there till you became a reader.
Yes, sir.
Then you had to take a break.
Yes, sir.
It was,
Yes.
I know, I have known you since then.
Yes, sir.
The passion that you had to take a fellowship in that particular institution.
Yes.
So throw some light on that.
Yes, sir. For those 4 years, sir, you can operate n number of minor oral surgery cases because you are doing freelancing, you are not sitting in one place. So number of cases and volume is going to be more. The initial days, only one aim, that tooth has to come out or that surgery has to finish. That's it. After time passes, probably 1 year, 1.5 years time passes, then the time accounts. So how shortly you are going to do, it will be beneficial for you, for the clinician, as well as to the patient. That understanding after 1 year or 1.5 years only that came in. So the way of working is almost changed. The after some period of time, or you can put it off after my fellowship program, it's not about the work, it's not about the time, it's not about the money. The art of performing the surgery is going to be totally different. You do it very lightly. It's like a passage from number 1 to 10 steps. The teeth is out or the minor oral surgery is done. That you need some fellowship program to get tune your minor teeth, even to do the minor oral thing. That's what it progresses, sir. Second thing, within these 4 years of period of time, it's a raw hands. You finished in Ramachandra, you got a good number of opportunity to work on trauma, certain amount of orthognathic and pathology too. Then you have to come and do, you have to practice. So these 4 years period, that too the college started, and you don't have any undergraduate as well as postgraduate for next 4 years. So you have to operate on your own. But of course, mentors will be there, seniors will be there to guide us, all those things. But you have to operate. Then that is the good platform that uh, you can get to operate all kind of cases.
by
Whether
yourself,
the results are good or bad, or you have to redefine everything. That is the best thing. Then
Always try for the best, and best things will happen.
yes. After 4 years, then you want a fine tuning. So where you want to get fine tuning, and that is the first time the fellowship started in India, sir, because we don't have that much of support, money support to go and perform
Abroad,
in
yeah.
abroad. That is the first thing Dr. Paul Sellens, Dr. Moni sir, and Dr. Ramananda Shetty sir, they worked together and
yeah.
start up with the fellowship program. So first batch jumped into that craniofacial surgery.
I know. So, if I remember right, I think Dr. Pramod.
Yes, sir. Pramod sir was next professor in after Paul sir.
Yeah.
And
So
Dr. Maria Kurikos is the surgical orthodontist over there.
Yeah.
And
So I remember that team, and
yes, sir.
yeah. So
whole
that
dedicated team. Sir.
Yeah.
Whole dedicated team.
So you were trained under them,
Yes.
and then you came back. So after honing your surgical skills to the next level, I think, like as you rightly pointed out, fine tuning.
Yes, sir.
You're already done so many cases,
Yes,
but
sir.
still you had the desire to fine tune it,
Yes, sir.
to improve your skill, and chose the right place, worked hard for it, because there was only one seat.
Yes, sir. Only one seat.
And
So
you
you have
worked
to.
hard for it, and you got it, made use of the best opportunity, and back, and here you are, excelling in your specialty.
Yes.
And uh, something personal
Yes, sir.
about your family.
Yes, sir.
Uh, yeah.
But my wife is an endodontist and two kids, sir. First one, Hamsini Guhan, she is doing her 7th, and second one, Mritika Guhan, she is doing her first standard.
Okay.
The best part is, after getting married, within 4 months period of time, I got my fellowship. She got endodontics here in SRM.
Okay.
So we have to study for the next time. Doing super specialty, she is doing her specialty, masters in between baby two. The next 1 year, the struggling, so the usual struggling for doctors. You have to work, you have to study, you have to earn. But the earning part, it's not going to happen if you're going to do in fellowship, dedicated fellowship programs. For the next 2 years, whatever the support, either our AOMSI pays or the institution pays, that is the best thing, that get hold of that money and do the fellowship, come out. That is the best thing.
Yeah, that takes me to the next question, work-life balance.
Yes, sir.
Your wife is an endodontist.
Yes, sir.
I'm sure she'll be going consulting. Is she associated with any institution?
No, sir.
No.
At present,
Okay.
no.
So
She's with a few consultations and only the clinic.
Yeah.
So she has to take care of kids because I'm the one roaming all around over there. So by 10 or 10:30, I have to go. Only the small child.
Two kids, yeah.
Yes.
Yeah, because that is another very important aspect, work-life balance.
Yes.
Because our kids are looking upon us as examples.
Correct, sir. Absolutely correct, sir.
So you're absolutely right, and leading this institution to great heights, and also people like you who are staying away from the association
Oh,
should come into the mainstream association,
got it,
who
sir.
have got a lot to contribute.
Sir, actually, I got inspired by you for getting into the association. Even Pramod sir and Kannan sir, so many people, they'll be starting every time they'll be start pushing into the association. But the contribution level, whatever you are going to give, I can't even imagine. I can't give for 5% or 10%, sir. That much of contribution you gave to society. That too, you organize these kind of master classes in from Australia, sitting there and start organize everything, and it went on very well. It's like paradigm shift for all kind of youngsters who pursuing their post graduation. They can able to understand the total concept of maxillofacial surgery, even because the book says some 50%, rest everything is for the experiences. So you mixed up both. So the experienced people also, they talk their way, and the academic people also, they taught in the special way. So actually the beneficiary is the youngsters.
Yes.
But these kind of contribution, I don't know, sir, how much energy that you are getting, that put heart and soul everything into the association, and getting a
That is because people like you are around to support.
sorry,
That is the reason why I'm asking you, why is it that people like you are not getting into the mainstream association activities to, as you know, our association is a 10,000 strong
yes,
association
sir.
now.
Yes,
So we need people like you.
yes, sir.
There are many who are coming, yes, but then I think I wish
Yes, sir. Very.
people like you who are multi-talented, multifaceted, to get into the association and get into the decision-making
Was for the
uh, core team
yes, sir.
for the betterment of the
Yes, sir.
next generation. So,
Yes, sir. I'll,
thank you so much,
thank
Dr.
you,
Bala,
sir.
for accepting our invitation and sharing your thoughts with us. Pleasure having you.